heart disease is a #1 cause of death for women, even in younger women. Why are even younger women more at risk?
Mainly because it's not really diagnosed, because we would expect heart disease usually in an older person with the typical risk factors like uncontrolled diabetes, morbid obesity, uncontrolled high blood pressure, history of whatever peripheral vascular disease. So young women oftentimes don't have any of those symptoms and still can have heart disease. Keep in mind, Emily, there are so many different nuances of heart disease. For example, just recently I saw a 40-year-old, completely healthy woman who suddenly also developed shortness of breath and fatigue. And make a long story short, she was diagnosed with a very rare virus infection which caused a myocarditis. We heard more about that since COVID, of course, because COVID also can cause myocarditis, but any other virus can cause that. And the vast majority of myocarditis cases actually heal out completely, but some go just downhill, and without a proper treatment they can die, even though there might not be any pre-existing condition or any risk factors. So we just have to be aware of the possibilities even in young women.
Yes, okay, so fatigue, something that we need to watch out for, be cognizant of. Any other symptoms of heart disease that women under 40 should be on the lookout for?
Well, just recently we learned a lot about migraine. And you might have heard that, Emily. So there was actually a couple of months, and 2 months ago, there was an interesting meta-analysis published, which looked at 18 clinical trials and found out that especially in younger people, in younger women, with migraine, with what we call an aura, which is symptoms which lead to migraine, have a significantly higher risk of having heart attacks, strokes, or even dying of cardiovascular diseases in the near future. So that's something relatively new. So if we have someone with migraines, frequent migraines, and those aura symptoms before the headache starts, that's something also to be alert and think about the risks for the heart.
And, you know, we talked about this at the beginning of the segment. I talk about it a lot. How can women become better advocates for themselves when they're seeking medical advice? It is so easy to go into your primary care physician, talk to them for 5 minutes, maybe 4, and just be overwhelmed with how fast it goes and not get all the questions out that you have. So how can we be better advocates for ourselves when we're going to get medical treatment?
Well, I wish I would have the ideal answer for that, Emily. I don't. But I mean, it's really, you have to present the symptoms as they are. And as you said very, very well, you know if there's something wrong in your body. You know if something has changed. From 1 month to another, you feel that suddenly your breathing is more difficult than it was maybe 3, 4, 5, 6 months ago, and there's always a reason for that, and that should be evaluated. And yeah, sometimes it takes a little push from the patient side to really ask the questions and say, don't you think, shouldn't I get some imaging study, or should I see a cardiologist, or should I do a further testing for that? There's nothing wrong with further testing. Be proactive.
Absolutely. I think that's the best advice. So Dr. Ernst von Schwarz, thank you so much for being here today. Always eye-opening information. We appreciate it.
Thank you for having me on, Emily.